In recent weeks, the number of COVID cases and hospitalizations has dropped dramatically across the country. While at the beginning of September, the U.S. was averaging around 160,000 new cases each day, that figure is now just over 90,000 and trending downwards. So is the nation finally approaching herd immunity? Here's what the nation's leading infectious disease expert, Dr. Anthony Fauci, told CNN on Sunday.
It's certainly going in the right direction. That's the good news, and hopefully it's going to continue to go in that trajectory downward. But we have to just be careful that we don't prematurely declare victory in many respects. We still have around 68 million people who are eligible to be vaccinated that have not yet gotten vaccinated.
And joining us now to share their expertise are Dr. Emily Landon, an infectious disease specialist at UChicago Medicine, where she leads its infection control and prevention efforts, and Dr. Evelyn Figueroa, professor of clinical family medicine at the University of Illinois College of Medicine. Dr. Figueroa is also director of the UIC Family Medicine Residency Program and executive director of the Pilsen Food Pantry, and we're thankful that both of these doctors made time for us tonight. Dr. Landon, let's start with you, please. So nationwide, COVID cases have been steadily declining in recent weeks. Do you think this Delta variant wave of the virus has it peaked, or is there another resurgence on the way?
Yeah, I think that the summer wave has peaked, and I think that a lot of places that didn't have as much immunity because of vaccination have now achieved some natural immunity through infection. But there are still a lot of pockets of the country that were relatively protected by immunization that are still eligible to have a wave of COVID come through this winter. And I think people up in the northern half of the country, areas, if you live in a community that doesn't have very much vaccination, you're probably at risk for a little bit of a bump. Hopefully, we're not going to see anything like what the surges that we saw in the southern half of the country this summer, but that's really going to be determined by how well immunized your community is.
And Dr. Figueroa, so we know just over 65% of the U.S. population has had at least one vaccine dose. For people over the age of 12, that figure is actually 76%. And as Dr. Landon said, that's, between vaccinations and those who've developed resistance by actually having survived an infection. Are we close to reaching herd immunity?
Well, I'm certainly not the herd immunity expert. That would be Dr. Landon and Dr. Fauci. But we are improving and making gains and strides in treating folks with COVID. One of the really big opportunities for us is just to really ensure that even though we're talking about these national rates of COVID vaccination in Illinois, folks are below the national rate. So we are decreased by a few percentage points. And that to not forget that that's an average, which means that some communities may be as low as 20%, where other ones are over 90%. So it's really getting into all of the communities and trying to myth bust as much as we can.
And Dr. Landon, I'll throw that question to you as well. How close are we to herd immunity?
Well, some places probably are already there, but the problem is you can't just be a little herd immunity in a whole nation that's very heterogeneous. And as this pandemic goes on, things get more and more hyper-local. And so it comes down to, if you surround yourself with a lot of vaccinated people, you're probably going to be in good shape, and if you're vaccinated as well. But if you're the only vaccinated person in a sea of unvaccinated, you're going to get exposed to COVID over and over and over again. You'd probably be more likely to get a breakthrough infection. So it really comes down to the nitty-gritty of, is that person sitting across from you or next to you or near you vaccinated too?
Dr. Figueroa, are we still seeing the huge racial disparities in the way communities are being impacted by the virus?
Absolutely. Essential workers are still essential. And a lot of people have had to go back to work. We know that locally different social service programs have been changing. Unemployment benefits have expired for lots of folks, so they have to go back into settings that are not always ideal. I do think that the Latinx population has caught up to the general population nationally, but there still is quite a bit of lag in the African American community. And I take care of a lot of African American folks at UI Health, so it's very distressing to me.
Absolutely. And Dr. Landon, as you were just saying, we know that hospitalizations and deaths are dropping in the city, but rural parts of the state, that's where cases are actually rising. And you were talking about vaccination levels, but how much of this is also due to continued vaccine hesitancy?
Well, we still have a lot of heterogeneity in the information that people receive about vaccines. The misinformation and disinformation is actually targeted at some of our minority communities. Sometimes it's targeted toward Republicans and people who don't necessarily consider themselves to be minorities. Sometimes it's targeted at people more in rural communities, but that targeted disinformation is costing lives. This is a safe and effective vaccine. And so when you have a group of people, even if it's just a book club that shares misinformation and bad information and dissuades other people from getting vaccinated, it takes a toll.
And Dr. Landon, also, what are your expectations for winter, and what can we expect out of flu season?
So I think we're going to see a bump of infections, and the amount that bump impacts us in Illinois, in Chicago, in your neighborhood and your zip code is going to depend a lot on how vaccinated that group of people is. And so I think we'll see a bump. It's up to us to decide how big it's going to be. Influenza, on the other hand, I'm really hoping that we can keep our masks on throughout the winter, because as we come indoors, unless you need to have your mask off for something, it's really just not that inconvenient to wear it. And that will help decrease the spread of influenza as well. Cleaning your hands and sort of keeping distance when you need to when you're unmasked is going to also make a difference for influenza. I honestly don't know what to expect with respect to influenza. The Southern Hemisphere is usually a great predictor for us, but last year, the Southern Hemisphere, especially Australia, was still in large-scale lockdowns, and South America didn't have much influenza, but they were still seeing a lot of COVID. So it's very difficult to know what to expect in our communities as we open up more, as the cases come down, people let down their guard a little bit. But it's still important to get your flu shot.
Yeah, and surely we're going to find out what the season is going to be like shortly. Dr. Figueroa, before we let the both of you go, one group of people who are not vaccinated, people under the age of 12, how much of a difference do you think that the expected emergency use authorization from the FDA for that age group, how much of a difference do you expect that will make?
Wow, it's going to be so impactful because it's really going to help us expand and help with gaps in a lot of the congregate settings that we're experiencing. Sending kids back to school has been heartbreaking for my patients and for a lot of members of our community. So it will be wonderful. Hopefully the communities will take advantage of the vaccine, because there are huge disparities in Chicago in uptake, but hopefully we can keep getting the message out.
Okay. Thanks to the both of you for finding time for us tonight, Dr. Emily Landon and Dr. Evelyn Figueroa, for joining us.
Thanks. Take care.